Bariatric surgery doesn't happen overnight. When patients come to my office, it's not the first time that they've thought about bariatric surgery. In fact, most of my patients have been investigating or researching bariatric surgery for a long period of time. The first step in the process is education. And you can do your education without ever having to see a surgeon. There's a tremendous amount of resources that are out there on the internet. There's a tremendous amount of resources that are out there in a patient-friendly manner, with YouTube videos, such as we're talking on right now, with websites such as my website at njbariatricinstitute.com. There are patient tools and issues that will educate you about the procedures and allow you to know the differences between one versus the other. The idea of whether these procedures may or may not be the right way to go is one which you can figure out easily now through publicly available services like websites and things on the internet. However, the idea of being able to choose your operation just based on the internet information that's available is probably short-sighted. The next step would be either to attend an in-person seminar, if that's your choice, or to schedule an office visit to discuss it with a bariatric professional. It's easy to contact an office and arrange an appointment so that you can talk to a surgeon or talk to a nurse in an office about the procedures and about how those procedures integrate with your medical history and what you can expect based on your own personal medical issues and your own goals related to surgery associated with each of the operations. Many patients, when they come to my office, think that they have the procedure that they want to have in mind, but they walk out reconsidering multiple other procedures simply because they don't have all the information that they thought they had prior to the visit. That's a good thing, because the decision that you make is a lifetime decision and you need to make it carefully and slowly and thoughtfully. There are specific tasks that people have to undertake prior to going to surgery. You can't come to an office and have surgery the next day in general. People undergo nutritional evaluations, behavioral evaluations, typically have an upper endoscopy to evaluate their stomach for polyps or ulcers or other abnormalities. And in many cases, we'll go on to have cardiac evaluations or sleep apnea studies or other such studies according to what their history might dictate. When those issues are all undertaken and that the patient has been designated in the best medical health that they can be in, then they proceed on to surgery. The process can be extended, however, because your insurance company dictates to a great degree how quickly you'll be able to actually access your insurance benefits. Some insurance companies will allow your information to be collected and submitted to them and turn it around in 3 days, and you'll be free to have surgery when there's an available opportunity. Some insurance companies will turn that information around in 3 weeks. Some insurance companies will turn it around quickly but put a barrier of a 6-month weight loss program in front of you. So the idea that you're going to seek the idea of having surgery and then have surgery within a week or 10 days, in most cases is not the way that it happens. It's a situation where you go through professionals. You deal with a professional and a surgeon in a consultation with someone like me. You deal with a professional from a nutrition standpoint. You deal with a professional related to a behavioral standpoint. Those people have specific interests and specific knowledge of bariatrics, the bariatric procedures and the struggles that patients have prior to surgery and after surgery. They want to know who you are, what's unique about you, and give you information related to things that you might struggle with after surgery. They're not barriers that are put in front of you by caveat or to make you jump through hoops. They're there to be people that you can access later on if you need people to help you adjust.